Guys, can microneedling really treat hair loss? Well, if you've seen any of my other videos, you know my take on this. But let's hear the thoughts of another dermatologist, the one here being detailed in this article by the Cleveland Clinic. So let's get started here. It says, microneedling is an effective way to reduce the appearance of scars, dark spots, and wrinkles on your skin. It's a minimally invasive treatment that triggers a wound healing response that can help your skin look younger. Some evidence suggests microneedling, also called dermarolling, can also stimulate hair growth. Yeah, I mean, it's not, dermarolling is not microneedling. Dermarolling is a type of microneedling whereby you're rolling, this manual handheld device over your scalp. But there's also dermastamps and dermapens that penetrate vertically rather than horizontally, and those are all microneedling. So, I mean, that's already wrong to begin with. But let's continue here. Could it be a solution for thinning hair? Dermatology specialist Taylor Bullock, MD, explains what you should know before trying this treatment. And then it says, does microneedling regrow your hair? Microneedling works by jump-starting your skin's natural healing process. Your dermatologist rolls a device with thin needles over your skin, creating tiny micro-injuries. Actually, if you go to a dermatologist's office, most often they're not going to be using a dermaroller. They're going to be using a dermapen or a dermastamp or another microneedling device that's powered electronically that can penetrate multiple times per second into the same spot into your scalp, and it's going to be a lot more effective. It's going to work a lot faster, but they're typically not going to be using a dermaroller, so that's wrong as well. Your skin responds by sending more blood flow to the area and rebuilding its collagen to heal the wounds. Okay? The wound healing response also happens on your scalp, which can help regrow hair in some cases. And then it says, the needles we use in a dermatologist's office are long enough to affect the hair follicle where your hairs grow, explains Dr. Bullock. The extra blood flow, collagen, and wound healing process can help your follicles produce thicker hair. Yep, so far all of that is pretty true. So let's continue here. Microneedling can also help topical medications like minoxidil penetrate your scalp, which could boost their effects. Minoxidil increases blood flow to your scalp, prompting hair to grow in thicker, says Dr. Bullock. Using microneedling in combination with minoxidil is more effective than either treatment alone. Yeah, I mean, that's been proven in studies time and time again, so that's absolutely true. The needles help to open up the skin barrier and deliver the medication at a deeper level. Yep. So then it says here, start with the correct diagnosis, but Dr. Bullock cautions that microneedling isn't a magic bullet for all hair thinning. Microneedling only helps with certain types of hair loss, he notes. Oh, it's a he. I thought it was a she. So that's my bad. But let's continue here. If you have hair loss due to an iron deficiency, for example, you should focus your efforts on iron supplementation and finding the root cause of your deficiency. Yeah, I mean, microneedling isn't going to be a permanent solution for any kind of hair loss. I mean, it's just, that's not the mechanism by which it works. It stimulates the wound healing process. It stimulates the production of certain growth factors that can help to stimulate, I'm saying the word stimulate a lot, so sorry for that, but it can help stimulate growth factors that can activate stem cells. And so that those stem cells can either turn into hair follicles, or they can, if they're already hair follicles, essentially, not hair follicles, excuse me, hairs, they can essentially mature into the anagen or growth phase once stimulated through microneedling. So it has a lot of different effects. That's the most important one in my opinion, but there's also there's also stimulation of blood flow into that area, sort of similar to any kind of other vasodilator. A couple of their effects as well. Also collagen induction. But yeah, microneedling is helpful in many different ways. But let's continue here. So what kinds of hair loss can microneedling treat? Studies have shown that microneedling can treat androgenetic alopecia, male and female pattern baldness, and some cases of alopecia areata. Your dermatologist may run tests to find out what type of hair loss you have, says Dr. Bullock. Then you can discuss what's causing your hair loss and how to effectively treat it. Yeah, I mean, that's not true. It doesn't treat androgenetic alopecia, and also it doesn't treat any kind of alopecia. It stimulates hair growth. It can activate your stem cells, which can turn into hairs, or it can stimulate, again, I'm saying stimulate a lot, but it can increase the phase, the duration of your anagen or growth phase of your hair cycle, and it can decrease the telogen or the sort of the shrinkage stage of your hair follicle. So that's what it does. So that's why it can increase growth, hair growth. It can make your hairs appear thicker as well. So there are many different kinds of benefits, but none of those address the root cause of any of these types of hair loss. So it's not just the iron deficiency or any other kind of nutrient deficiencies. It's any kind of alopecia that you have. Microneedling does not address the root cause. However, it will help to stimulate hair growth regardless of what type of alopecia you have. So let's move on here. So before you spend time and money on microneedling or any hair loss treatment, see a licensed dermatologist first. They can give you a correct diagnosis and recommend options that work for your specific needs. I mean, like I said, whatever type of hair loss you have, microneedling done safely is going to help. Most likely, right? I mean, for some people, it just doesn't work at all. But that goes with any kind of hair loss treatment. So it's not that it works specifically on certain types of hair loss or alopecia. No, I mean, theoretically, it should work on anything. It just doesn't address the root causes of anything either. But let's move on here. Microneedling with platelet-rich plasma therapy, PRP, for hair loss. PRP has gotten a lot of press recently. A healthcare provider injects platelets for your own blood to prompt it to produce more collagen. PRP can help regrow hair when used on top of standard treatments for diagnosed hair disorders. Yeah, that's all true. So more on microneedling here. Can I do microneedling at home? If you're dealing with hair thinning, it's tempting to pick up an at-home microneedling device so you can get immediate results, but store-bought devices don't compare to a professional microneedling treatment. I mean, I don't really agree with that, but let's see what this guy has to say. The at-home microneedling devices are very different from the devices we use in dermatologist's office, warns Dr. Bullock. In the office, we use longer needles that have a more powerful effect. The needles you get in an at-home device are often less than 1/10 the length of what we use. I mean, no, that's not true. Unless you're using a 0.25 millimeter dermaroller, in which case, yeah, I mean, professional microneedling devices can usually get up to 3 or 3.5 millimeters in length. But most people are not using a microneedling device of 0.25 millimeters, especially those who are really trying to get serious results with respect to their hair growth. The most common needle depth that people are using is either 1 millimeter or 1.5 millimeter. So that's definitely not 1/10 the length of what professional dermatologists are using, right? I mean, they'd be using at most 3 millimeters or 3.5 millimeters. As I said, they're not going to be using a 10 millimeter needle on your scalp. So that's not true. And also this idea that the dermatologist can do it better than you can, I think is very overplayed. It's not like this is some rocket science, and they're not specifically trained on the art of, how to specifically, roll this device on your scalp either. I mean, I'm sure they get a little bit of training, but it's, like I said, it's not rocket science. You just glide it over your scalp in circular motions. Just because they do it is not going to be more effective than you doing it. Also, when it comes to the microneedling device and specifically its length of the needles, almost all studies with any kind of credibility show the effectiveness of needles at between 1 millimeter to 2 millimeters. So that's the length that's been studied. It's unclear whether there's more effectiveness as it gets longer than that. And a lot of dermatologists' office will use 3 millimeter microneedling devices. And that's fine, but there's just less evidence for that being as effective just because it hasn't been studied as much. But let's go here. You can purchase a dermaroller from a reputable company, but don't expect the same results as professional microneedling. Yeah, I disagree with that. At-home devices might help medications penetrate better, says Dr. Bullock, but home dermarollers aren't going to trigger the collagen and wound healing response you get from a dermatologist's treatment. Absolutely disagree. There's tons of evidence that even at-home treatments can have the same effect. Risk of do it by yourself microneedling. There's a reason why at-home devices use much shorter needles. They don't really use much shorter needles, right? I mean, you're still using 1 to 1.5 millimeters most of the time, and that's the length that's been studied time and time again to be effective. Using a dermatologist grade device at home isn't safe. Why not? Using a medical grade dermaroller at home would be very painful, warns Dr. Bullock. It's not that painful. You could also permanently damage your skin or get an infection. Absolutely not. I mean, unless you have the weakest immune system in the world, you're not going to get an infection. You're just not. That is so overplayed and it's just a scare tactic. Only a licensed and appropriately trained provider should use these devices. Okay. When a dermatologist performs microneedling in the office, they apply a numbing medication first. Not all the time. Some people don't need it. They also sterilize the equipment and take steps to prevent infection. Yeah, you can sterilize it with isopropyl alcohol at home. Everyone does that, 70% plus, before and after. We have training in how to successfully use these powerful devices. This is not rocket science. It's not like you have some magic hands that know the exact pressure to apply in a microneedling device. That's absolute BS. But okay. If you want to do microneedling at home, stick to the devices meant for at-home use and don't overuse them. See, that part is true. You shouldn't overuse microneedling. Some people do once a week. I actually personally think that's too much. Do at most 2 times a month, if not once a month. I think that's plenty. More isn't necessarily better. Yep, you need time to give your skin, or you need to give your skin time to heal between treatments. Absolutely true. And then finally it says, hair loss treatment isn't one size fits all. Hair loss is complex. Your treatment will only work if it's addressing the root cause. Microneedling isn't addressing the root cause. That's why your first step should be getting a medical diagnosis. Yeah, that's probably true. There's hope if you're dealing with thinning locks. You don't have to accept hair thinning as part of life. He reassures many treatments are available and research continues to find new hair loss treatments. No, research has been completely stagnant in this area for decades. And now they're coming out with new treatments that are in, phase 3 of clinical trials, like pyrolutamide, and others as well, that are getting there. But so far, we still have the same old treatments that are FDA approved that we've had for decades. So it's not research continues to find new hair loss treatments. It's been completely stagnant. It's exciting to see patients experience a confidence boost when we help them regrow their hair. That I can agree with. All right, guys. That's all I have for you guys today. What did you think of this article? Do you agree with the dermatologist? What have your experiences been with microneedling and other hair loss solutions? Leave a like, thumbs up, comment below, and yeah, see you next time.